today I will be teaching you guys about a disorder that I decided that I wanted to research more about, and I will use all the research that I gained, all the information that I gained from that research to teach you all about this disorder. So the particular disorder that I decided to choose based on the list of disorders that my teacher provided is sexual pain disorder, also known as genital pelvic pain disorder. It affects people, both male and women, but it especially affects women. Being that I'm a woman myself, I decided that why not learn more about something that can possibly affect me in the future. Now that I learned about it, I also not only learned what it is, how you can get it, but also how to treat it. So I'm going to share what I learned about it with you guys. My name is Kayla Gaspard, and I will be your teacher. So, sexual pain disorder is pain during, before, or after sex. This pain particularly happens in the pelvic area and in the vagina. In the DSM-5, this includes vaginismus, which is when the muscles in the vagina tighten up, and dyspareunia, when sex causes consistent and reoccurring pain. Both can make sex uncomfortable or distressing. What can cause sexual pain disorder? Now, there are physical causes and there are psychological causes. I personally found it very interesting that your state of mental health can also give you this disorder, because sometimes people usually are only used to something more physical as the cause rather than psychological. So I found that very interesting. So the physical aspect of what can cause it can come from infection, hormonal changes, childbirth injuries, or pelvic floor issues. Now, if you have any of these things, you could possibly be at risk for having this disorder. The chances aren't extremely high, but it is possible for that to happen to you. Now, the psychological causes can be anxiety, past trauma, relationship stress, or fear of pain. So basically, the psychological issues more so either comes from past trauma, from past sexual experiences specifically. You consistently being afraid of it hurting can also affect and cause, and relationship stress, if you're in a relationship that's stressing you out, that as well, and if you have anxiety. So unfortunately, those psychological factors can contribute to you having this disorder. Now, sometimes if you have both of these causes, if it's both psychological and physical, that can make it 10 times worse, which is very unfortunate, because it is possible for someone to have either of these things on the list. So now the symptoms. You're probably hearing this if you are sexually active. I'm sure hearing me talk about this probably made you wonder, do I have this? It seems like something that's easily obtainable, although it's not an item. If you are sexually active and you would like to know if you possibly do have this, I will discuss the symptoms that you would have if you potentially have. So the symptoms for someone that may have this disorder: burning, stinging, sharp pain during sex, fear of sex, avoiding sex, muscle tension, or clenching. If you have any of these symptoms and it's consistent or reoccurring, it is possible that you suffer from sexual pain disorder. If you have it, like if you've had these symptoms maybe once or twice and it was a very big gap in between, I probably wouldn't say that you have to worry. But if every single time you've had sex, or if recently, it's been consistent, every single time you have had these symptoms, let me tell you what you do. If you think you have these, treatment. This is what you do if you think you have these symptoms. If you think you have these symptoms, first, you should of course go to your doctor. Let them confirm first. I am not a doctor. I am in school to be a nurse. Maybe I can diagnose you in the future, but as of right now, I'm just a student. So, go to the doctor, get it confirmed. But if you do have it, after being diagnosed, your treatment that you'd be receiving would be either pelvic floor physical therapy to help relax your pelvic floor, counseling or talking to a sex therapist. Medical treatments may involve topical creams due to the fact that this could be from an infection, hormonal therapy, and treating the infections if it is an infection. So that would be the treatments that you get when you are diagnosed with this condition. Now, to conclude, it is very common, but it is also treatable. And learning about this reduces the stigma and encourages healthy communication and healthy sex lives. Thank you so much for allowing me to teach you guys today, and I hope you guys have a great rest of your day. Good